Thank you so much for joining us. You are at a webinar delivered by Sydney North Health Network, Northern Sydney's primary health network. I'll introduce our speakers in just a moment. So today's webinar is around the Help app developed by La Trobe Uni, so the Healthy End of Life Planning tool, a digital tool that we think you'll all find incredibly useful for your services and for your patients. I would like to acknowledge that wherever you are today, we are meeting on lands of traditional custodians, and I pay my respects to elders past, present and emerging. And today I'm on Gadigal country of the Eora Nation. So I will hand over now to our presenters, Sally and Holly, with a little bit of background information on the screen there for you too.
Welcome everyone, welcome and thank you for giving up your time to be here today. We really appreciate it and we hope that you'll find this information really useful and hopefully see the benefits it could have for people that you work with. My name's Holly Smith and I'm one of the partnerships coordinators at the Public Health Palliative Care Unit at La Trobe University. My background is really in public health palliative care, and I've worked on some of the early compassionate communities groups in Australia. I've also done some training with one of the early pioneer communities that kind of kicked off social prescribing, which is becoming more and more widely known. So really excited to share more about that with you in the context of the Help app today. Sal, would you like to introduce yourself?
My name is Sal Brown. I'm coming to you today from the very grey-skied land of the Wurundjeri people of the Kulin Nation. So my background is ostensibly in oncology. I started as a radiation therapist straight out of school and then went into education. So I was a senior lecturer and course director for a while, both here and in the UK, and have been working in palliative care in the community mainly, or all the time actually, since 2007. So working in a couple of community palliative care services as quality and safety managers in the main role, and have been working with the team at La Trobe for 12 months now. So it's been a very lovely 12 months with working with the team and the app.
Right in the deep end, weren't we, Sal?
Yeah, we were. That's okay.
So Sal and I have been on the team for the last 12 months, a bit over. But the team at La Trobe has been working on this app and the background research for over 10 years, really looking at working a lot with communities over the last 10 years and looking at what supports people need to die well in their place of choice. So we're bringing to you a lot of really well-researched information that our team has been doing for quite a long time. All right. So we do have quite a lot to cover today, so we're going to try and speed through it. And then there is allocated time at the end to answer any questions. So yes, please feel free to submit any questions through the Q&A function and we'll get to them at the end. If you have a pen and a notebook, that would be great because there's a couple of little activities we're going to ask you to do. So maybe grab a pen if you can. And just looking at the aims of this session, we're really hoping that you'll gain an understanding of network-centred care and how this really improves end-of-life experiences. We're hoping this will offer insight into palliative care social prescribing and the Help app. And hope today you will gain confidence in delivering the social prescribing model to patients and families as part of your routine practice, is the aim of the game. Okay, so let's start with why we need the Help app, kind of the background to why this was developed. I think it's probably not news to anyone when we think about end of life in Australia, something really needs to shift. We know that our ageing population is set to double by 2050. Our health system is stretched. We know that from the research, being socially isolated has a really severe impact on our health and well-being. One research project has found it to be as damaging on our well-being as smoking 10 cigarettes a day, being socially isolated. So when we think about that, it's clear to see that staying connected to our networks is a really important part of our care plan as we age and as we die. We also know that when someone's facing end of life, they will typically spend about 10% of their time with a health professional. So they've got the whole other 90% of their life, their time in that part of their life, where they're on their own or with their family, their friends, their pets, neighbours, colleagues. So we're really interested in how we can really amplify the 90% of their time. Looking at how we interact with our community and how much we really need our community, our friends, family, and wider connections to be more involved with us as we age and as we die. We also know that while patients and carers might transition between service providers during this time, the end of lifetime, the support network is what remains constant and can travel with them across these transitions. And I'm sure everyone attending today can think of stories that you've come across through your work around the impact of being connected and well supported as people age. So now we really believe that in terms of the evidence, it's now a case of best practice for us to encourage and support our patients and clients to really activate their network as part of their care plan. And that's why the Help app has been developed. So that's quite an easy thing to say. People need to activate their networks, but it's a bit harder to really put into practice. But something that can help us is to really understand what the barriers are for people in terms of staying connected with their networks. Our team's research over the past 10 years has identified two key crucial barriers when it comes to people accessing their informal care networks. We know that Australians really rally and know how to help someone when it comes to sudden unexpected death, a tragic death, or natural disaster. We've seen that in recent years in terms of flooding and fires, and how communities can really rally together and support each other through that. But what we've found is people are less likely to support each other with an expected death, which is around 70% of deaths in Australia. So our research showed that people really do want to support their friends who are caring for someone, but they don't feel comfortable to kind of step up and offer help in that same way. That can be for reasons like they don't want to intrude, they don't really know how to help, or they don't want the person to think that they think they're not coping. It's a bit of an awkward barrier. Our research also showed that when people were caring for someone at end of life and really did need support, they didn't ask for it and they didn't accept it when it was offered, even if they had quite rich social networks. Some of the barriers in this scenario were things like, really feeling that pressure of, I'm caring for my mum, it's my responsibility, I'm the one who's got to do it. Not wanting to be a burden on others or, put others out. And also people in caring roles, they have their systems worked out and they didn't want anyone else coming in to kind of mess that up. Also the self-consciousness of not wanting people to think that they're not coping with what they're going through. So the Help app was developed to be a tool that really addresses these barriers effectively. And we know from our work, just getting the word out about the app so far, people are most likely to use it when it is prescribed to them by health professionals or other service providers as part of a routine conversation around their end-of-life plan. So weaving it in as well as talking about their medical care is, we know they're more likely to download this app and use it if they're prescribed it, which is the social prescribing we're talking about today. Okay. So the way Help breaks down these barriers and allows communities to support each other is, in a nutshell, it is people download the app, they're invited to join a care network, and the person who's at end of life or someone who is supporting them list different tasks and activities that they might want or might need support with. And anyone who joins their care network can then see those activities in a calendar, and they can choose whether they accept to take responsibility for that activity or not. And these activities and tasks can be anything from walking the dog to picking up some medication from the pharmacy to driving someone to an appointment, anything. So we're going to learn more about how that might support someone and their community in this short video that we're going to watch. So.
Hi, I'm Kate. My friend Lucy is caring for her dad, who is sick and nearing the end of his life. I'm helping to coordinate a network of support through the Help app. I'm the captain, or coordinator of the network. I have offered to coordinate support for her through the Help app. Lucy is not very experienced with technology. So we started off by listing a few things that someone else could easily do. Identifying a few people who have said, "Let me know how I can help." A network can start with 2 people and can grow from there.
The free Help app coordinates social and practical support for people caring for someone at the end of life. A trusted person can coordinate the Help app for people who don't use apps.
Hi, I'm Li Jin, Lucy's good friend. I knew Lucy had a lot on her plate. We haven't seen her at the gym for a while. I didn't know whether to give the family some space or show up and offer help. I didn't want her to feel uncomfortable or alone, so I was glad to see the invitation to become a part of her support network.
Tasks that could be helpful are listed and added to the calendar.
Hi, I'm Jules, Lucy's sister. Even though I live far away, there are things listed in the Help app that I can help with.
Hi, I'm John, Lucy's neighbour. I could see the garden getting overgrown, but I didn't know whether to just do it or would I be intruding. Mowing the lawns is easy for me and I love knowing I can be useful at a time like this.
The Help app makes it easy to include people in outer or inner circles of care to allocate tasks accordingly.
Hi, I'm Lucy. I'm getting used to people helping out, and now I've started feeling more comfortable asking for support. I even use the Help app to schedule some fun with our friends. It's easier to invite people to join my network in the app rather than asking people every time I need something. I can add new people and different tasks anytime. My load feels lighter now.
Not only does the Help app coordinate tasks, it offers links to articles and useful tips for caring for someone at the end of life.
It was so good to be able to help my friend in such a practical way. Sometimes she needed a lot of support, and at other times we could step back. We all stayed connected through the app after Lucy's dad died and could support her with her grief. I feel closer to her and the others in the network now. Some of them I'd never met before.
Choose what help is needed. Roster activities. Schedule appointments. Add family and friends to your network where they can see and choose how they can help. Use the chat function in any language. Share end-of-life wishes. Learn about end-of-life issues. The free Help app brings people together in one central place, making it easier to stay connected and share support when someone is at the end of life. People often want to help out, they just don't know how. The Help app is approved by health professionals and is now being used as a part of palliative and end-of-life care delivery. Download now and have a conversation today with your family and friends.
Thanks, Sal. So we're going to zip through some of the key functions of the Help app. So you would have seen some of them discussed in the video just then, but here's a bit of an overview. So the app can have a single coordinator or about multiple administrators. So the person who sets up the network is called the captain, and you can then add different administrators who can also help to manage the app. You add and invite contacts to join the network either through the contact list on your phone, or you can also invite them via a link. To create personal care needs, that's the tasks that get listed. So anything that the person at end of life is needing to help them day to day, that is what gets listed. And you can add appointments and events to the calendar. So that might be important doctor's appointments or, excuse me, when someone's getting test results, that kind of thing. We have a chat function that works in any language, any keyboard language that anyone has on their phone. And the chat function can be organized in different folders and can be shared with the whole support network or just the inner circle. We have two tiers of contacts in the app. You can also share documents and photos through the app. So this can be really useful just in terms of keeping the network updated with whoever is at end of life, but also can be really practical. We do know people that have shared the digital prescription QR code in that folder, and someone in the network's been able to pop off to the chemist and get that for them. The app also has tips and education around palliative care. So it's a bit like having a palliative care expert in your pocket. And there's a help desk for any technical issues that is Melbourne based. So it's useful. It's in our same time as us, and the help desk will get back to you within 24 hours. So it's passed the app, through the Trobe University has passed a really vigorous ethics approval. It's all onshore data security, and it's been approved as a safe app to use by the South Australian Government. It's one of our partners currently. It's always good to know.
And I think that the other thing to point out, as Holly said about the chat function, can be in any language, and that's the same for setting up customized tasks. So they don't have to be in English. They can be in whatever language a person has on the keyboard on their device. And there's also the option for talk to text. So if somebody can't type, then they can actually talk. They can press that record button, and it sort of makes some semblance of English usually at the end of it, depending on how quickly you speak. I always have issues, but that's another really good a really good thing to know with people, that if they're not sort of very good at typing on the smaller devices, that they can actually do that talk to text as well.
Yeah, I think so. It's a good note for accessibility. So we'll just briefly speed through this in terms of how the app gets set up, because it's good to know. But getting started is pretty easy. You can download the Help app by searching for Healthy End of Life Planning. We'll also send as a follow-up today a QR code that you can easily download the app from. You register the network by giving it a name and a brief description, and then you can invite the different contacts inside the app just through your phone, or manually entering a number, or by sending a link. And then there's a few questions that you get asked in terms of setting up the care needs that help kind of populate with some suggestions. So it can be a little bit overwhelming right at the start for someone to suddenly be asked to list everything they need, but we can help get them along by some of the categories that are developed through the questions that are asked at the beginning. Yes, and then we've got the helpful tips section where you can learn more about how to use the app, but then also really useful information about kind of key end-of-life services. As we were just describing the chat function can be organised into different folders for different information. So a common challenge that people have, we hear a lot about when someone's ill or they're caring for someone, is the constant messages and phone calls they receive from people wanting updates on how it's going, especially after like a hospitalization or a visit to one of the doctors. So folders in the chat function can help alleviate this, because information can be shared with the network about the person's condition, and all the information's in an easy to access place. I know we've all been through, I'm sure we've all had that experience of being in a WhatsApp group for something, for accessing information on something, and it's quite a pain in the ass to have to scroll back and back and back for weeks of information when you're just trying to find one thing. So the feature of being able to organize the chat into folders is a really great one. Folders could be set up for specific topics like test results, prescriptions, like we mentioned before. It could be, activity ideas for when you come to visit Dad, that kind of thing, or photos of Dad in his favorite chair, updates, like to keep people informed. And as we mentioned before, there's the option to have just the inner circle, so certain members that you select, just chat folders being shared with just them, or you can share it with everyone. That is quite an easy thing for you to decide. And then the tips feature, the tips are regularly updated by La Trobe University staff, and they cover a wide range of palliative care topics, like having a palliative care expert in your pocket. You can whip it out anytime. And the whole network can access these tips and education too. So the whole network is learning alongside each other and increasing their death literacy as well. So just to summarize, everything in the app is managed by the 5 icons you see there in the app there on the bottom, not on the side. The planning section is where you add the tasks and relevant dates. The inbox is the chat folders. Tips is all the valuable end-of-life information. And network is where you manage who's invited, and you can change or manage their roles in a nutshell. Okay, so I'm going to hand over to Sal now. He's going to talk us through how we get people using this app.
That's the plan, is to
I'll just jump in and be nosy when I've got something to say.
No worries. So this definition of palliative care social prescribing has just been released in the updated National Palliative Care Standards 5.1 edition 2024. And it's been, the standards have been updated in a recognition that that there is a need for that sort of social support alongside the excellent medical and healthcare that people are getting. So the brief intervention is a palliative care social prescribing model, and it's how we get people to utilise the app to access their support networks. So it's a strengths-based delivery model involving healthcare and other providers referring patients and carers to community-based resources and informal networks of care. So that's that network-centred approach. And that's what Holly was talking about earlier, about having that referral from a trusted person. So it's, the doctor has told me I should do this, or the nurse has told me I'll do that. So it's that having that referral from a trusted provider. So, and as we've also discussed, that social connectedness is prescribed to improve the patient and carer outcomes and quality of life during and beyond life-limiting illness. Social prescribing leverages existing community assets such as friends, family, colleagues, neighbours, community members, and other place-based groups and activities. As I said, so as these are now part of the national standards, so with the next update of the National Standards Assessment Program, so services, if they choose to use that program to assess themselves against the national standards, this will be something that we have to be looking at what we're offering our clients and their carers in the future. So we're going to watch another video now very quickly just about the brief intervention. I won't put my audio off this time and mute it and muck everything up.
We all have times when we need some help. Without it, it's easy to become isolated and overwhelmed. For someone living with a life-limiting illness, and for the people around them, support is vital. While our health and community services provide essential care, They cannot do what our family and friends can do. Walking the dog for us, dropping off milk and bread, providing transport and company at appointments. The things we need help with are different for everyone. We may need it only once or on a more regular basis. Help can be both ordinary and extraordinary. It can be having a conversation to face a difficult thing. However, we all know that asking for and accepting help can be hard. With healthy end-of-life planning, it becomes easier to ask for and to lend a hand. People want to help out, but don't always know how. With help, we bring people together to coordinate the right help at the right time in the right place. Looking after our social well-being is just as important as looking after our physical health. Having strong social networks as we age and live with illness can make a powerful difference. Friends and family can help us with everyday tasks and improve our access to other support and options at the end of life. The Healthy End of Life Planning Brief Intervention is a new service delivery model that integrates expert healthcare with the social and practical needs of people at the end of life and their carers. Wrapping network-centred care around person-centred and family-centred approaches allows people to mobilise others in their social circles, to spend time together and contribute when and how they can. By prescribing social support as a part of routine care, trusted professionals essentially give permission to people to ask for and accept help. The Help Brief Intervention is easily delivered within the day-to-day context of service delivery and takes as little as 5 minutes. It can be delivered within any setting and by all practitioners, producing long-term, sustainable impact with families and communities. Offering one central place for people to plan, connect and share, the Help app stays with families across multiple settings and through the end-of-life and bereavement journey. Important information is shared, help is rostered, and in-app education is provided on all end-of-life issues, including grief. When the Help app is used by families, they are contributing to a national de-identified dataset, postcode by postcode, that will help improve social outcomes at the end of life through ethics-approved research at La Trobe University. Professional development, co-branded resources and implementation support can be provided to organisations that choose to integrate help into their programs.
This. Sorry. Okay, so that's just a brief overview of the brief intervention. Everything's very brief. I've just marked my camera up now. So the brief intervention in practice, as we've said, it can be delivered, as the video said, it can be delivered in as little as 5 minutes in any care setting. And this is in acknowledgement of the huge amount of work already that health and community services provide. And it's been designed to be resource efficient. So what we don't want is for people to think that introducing the brief intervention and the Help app and how it can benefit patients and clients and carers is going to take another hour, because we're all recognise that everybody is we're all very busy these days, and there's so much stuff that we have to get through when we're seeing clients and carers, that to think that there's another thing that's going to take another 40 minutes is just that sort of a little bit too much for a lot of people. Anybody can prescribe it, so any healthcare professional, as we've said, it's a trusted professional. It's giving the person and the carer, the patient and the carer permission that the doctor said I should try this, the nurse said I should try this. We're finding that in a few places we're actually working with volunteers as being the people to prescribe the app to their clients, because they have that really sort of, like quite a different relationship to the healthcare professionals. They spend more time with the person. It's quite safe and time limited and with lasting results. So what we're finding is that some of the networks that we have, after the person has died, those networks are continuing on. So that sort of ongoing support of the person in their grief and bereavement is still there, and also just increasing death literacy. So then perhaps next time that there's somebody in their circle that is having an expected death, that they would be less reluctant to approach that person and have that conversation about what can I do, what do you need, how can we help. The evidence is that people will ask somebody what they need 3 times and then they won't ask again. So this is a really good way at sort of building that literacy and giving people that sort of feeling brave enough to keep sort of asking the person for the support. And the 5 minutes of intervention can bring around up to 12 months of benefits, and that's that ongoing thing. So as we're seeing with the ongoing support for grief and bereavement with the people who have died. So again, just sort of when we're changing the landscape, it can change in practice. So we're sort of looking at that sort of network-centred care alongside the health and medical supports. So making sure that people are recognising that support is just as much needed as the medical, the symptom management and all of those sorts of supports. So we know it works best when it comes from a trusted source, as we've said. So it gives them that chance to shift the accountability about asking for help because somebody else has told them they should do it. That it's prescribed as routine treatment. It's one of those things that is what is being offered alongside all the other services and supports that the healthcare professionals are providing. That the conversations show around the value of the role of family and friends alongside the healthcare professionals. So making sure that we're acknowledging that is needed alongside that excellent other healthcare that we're providing people. That we have some support to get them started. We're finding that if we give people information about the app and then say off you go, that they're less likely to sort of use it to its best advantage, as opposed to if we spend some time with them thinking about, and we'll go through this in a minute, thinking about what tasks they might need and who they might ask into their networks. And also, and probably most importantly, and certainly having been a quality manager in community for a long time, setting really clear expectations of what we do and don't do as healthcare professionals. So what happens in that 90%? So, so the 10% of time that we're spending with them, that we will ensure that their medical needs are met, that their symptoms are managed, that we will refer them on to other healthcare professionals, that we'll organise tests, investigations, or, visits to palliative care units for, for respite or something. We can do all of that. But that other 90% we can't do. We can't walk the dog. We can't do their shopping. We can't take them out for a coffee. We can't take them to an appointment. And certainly feedback that I used to get was that people, if they were disappointed with the services, that's what we didn't do. So we weren't doing, picking up their shopping on the way to doing one of 6 visits that the nurses had to do that day and all of that sort of stuff. So we really need to be very, very clear from the off about what we can and can't do as care providers. So it's a bit of a 3-step model of how we integrate this into our service delivery. So as we've said, who can deliver it? Anybody. So any healthcare worker, any service provider, anyone in the person-facing role. So, as I said, we're using volunteers a lot because of their relationship with the clients. What is it? So it's the act of prescribing that network-centred care. So prescribing the act of reaching out to networks and to communities to have that support base at home for them as they're caring for somebody who's dying. So we know that somebody is more likely to ask for help if it's, as we've said, if it's suggested to them. So it's communicating to the person that their social and practical supports are just as important as the care that we're providing, that medical care. Then we're encouraging people to ask for and accept help. So, you know, thinking about, and because people quite often say, oh, I don't have anybody to ask. And then, so you could sort of say to them, well, has anybody asked you if you need some help? Perhaps you can start with that person. That let's reach out to those people and see what's going on. Or asking people who they might help if somebody else needed help. That's quite often they say, no, I don't need help, but, you know, I would help Susan if she needed it, you know, in a heartbeat sort of thing. And then, as we said before, assisting them with accessing the app, and, you know, helping them download and thinking about tasks and how they might best utilise the app. We've got some resources that we'll run through at the end that we will send you that you can use with your patients and clients. I use those terms interchangeably. I'm sorry, I'm not quite sure. With, you know, clinical people use patients, and, you know, services sometimes use clients. So it's I switch between the two still. I'm a bit torn. So one of the really good activities to do with people, and something to do, we can do sort of, I'll probably just talk through it now with the presentation, but teasing out what are the ways that people can help. So 101 ways, we call it the 101. We're up to about 600 and something now. We've got lots and lots of ways to help.
So 1,001 now.
Oh, 1,001. Oh, I've run out of fingers and toes hole. How about that high? But it's getting people to think about what help they need, but also getting them to think a little bit out of the box. So it's not always something that might be done, needed to be done regularly. So we sort of assume that people would want meals all the time, but we're finding that it's companionship, friendship, coming over and having a cup of tea with me, having a chat about advanced care planning, end-of-life care, thinking about those things. It can be meals. It can be, as Holly said, it could be picking up prescriptions and putting the QR code for the prescription into the chat function. You know, walking the dog, things like that. And then also we did a session in a rural service a few weeks ago and completely blew our minds, because it's things like moving animals from one paddock to the next, picking up the mail when you go into town because you live 50 kilometres out of the city, those sorts of things. So really having a good teasing out of different tasks that people might need help with. And sort of, you know, as we said, we've had somebody needed a ramp put in, somebody needed firewood cutting. So it can be one-off. It doesn't have to be something that needs to be done every week or every month or whatever, you know. My cousin's partner was dying. He's Italian, vegetable garden, very important. So it was very important that we had a roster to order Kev's veggies. So, you know, those sorts of things are really important too. So it's just depending on what was important for the person and in what they need at the time. And sometimes it's hard at first. So, you know, they might sort of go away and have a bit of a think about it and then come back when they've got 50 tasks. When you left them yesterday, they had 20. So, you know, those sorts of things. It's not a one-off. So once you've set the tasks up, it doesn't mean that you can't add any more tasks in. So when we're thinking about our networks, as Holly has mentioned earlier, we in the app we have an inner circle and an outer circle of people that you can invite into the network. So as you can see on this image, we've got the person at the centre, the lady with her dog, at end of life, and then we've got the inner and outer circle. So we've got our medical supports in there, and then we've got close family and friends. We've got other people in the community, church members, colleagues from work, friends of parents, you know, parents of kids that the kids play sport with. I don't know if I said that in English, but, you know, parents of children that your children play sport with. It might be people from the gym. It might be people you see walking past your house, walking the dog, and, you know, you've walked the dog with them and those sorts of things. So those people can be included in networks. What we say with the inner and outer circle network, the inner circle tends to be the people that you would be really happy to have those very deep personal conversations with. So it might be around your end of life wishes. It might be around your fears. It might be around your, other sort of personal needs perhaps that you have. And those people wouldn't necessarily be your close family and friends. And what we find when we do the network mapping, people tend to go towards that family tree. We go straight towards our family tree. You've got, your mum, dad, your uncles, your aunties, your cousins, all of those sorts of people. Well, they might not be the people that would be the ones that you would want to have those really deep conversations with, or to share those sorts of fears with. It might be, your two best friends for the last 40 years from school, and perhaps one of your siblings, and those sorts of things. So you can have different people in the different circles. And I think that that's a really important thing to know, that you don't have to have. So if you've got the lady that walks the dog and but you wouldn't want her to know everything else that's going on, she could be in the outer network, and then they sort of get some information, but not all of the information around the conversations and the tasks. I think that makes sense. I hope it makes sense. So when we're thinking about the mapping, as I said, so it's thinking about if anybody has asked somebody if they can help, then that's usually a good starting point. Sometimes the person who is at end of life might not feel confident setting up the network, so they could have a good organizer, could be a cousin, a close friend, or an adult child. We're actually finding that most of the networks are being set up by adult female daughters of the person at end of life, aged between 35 and 50, which is not really surprising, because that's kind of where it usually happens. So it doesn't have to be the person setting up the network for themselves. Thinking about the inner circle, it might be the people that you'd be happy seeing in your pajamas in the middle of the night, the person that you would call in the middle of the night to, cry down the phone to, or whatever. They would be thinking about those sorts of things. And then other people thinking about face-to-face online with people you talk to on the phone. These are all sorts of people that could be teased out to be in the person's outer circle. And then those sorts of people you might only see once a year. Some people feel that they live too far away and they can't contribute, but, they can do an online shop. They can have those conversations about end of life. They can find documentation for people if they need it, and those sorts of things. So there's lots of tasks that don't have to be done by somebody who's living in the same house or, city or state necessarily. So there's that sort of really wide range of people that can help with the network.
So I'll just jump in there as well, just encouraging anyone who, when we run longer workshops, we get everyone to draw 2 circles, and in the smaller circle write their inner network, their inner circle, who they would want to have all of that kind of crucial personal information. And then the bigger circle to put in kind of their wider network. And really encourage you to do that as an exercise. Use some of these questions to kind of prompt that, because it does really help then assisting others to unpack who might be in their network. Yeah, and it can be unexpected. I know in my case, when my mother was caring for her parents, they were quite isolated and didn't have a big social network, but my mother did. And it was a lot of her friends that then started visiting my grandparents and became part of their network that way. So yeah, it helps to map your own to then assist others to map theirs.
Absolutely. Yeah, in one of our volunteer sessions, when they did that, she actually put down a whole lot of her children's friends in her network, because they were the ones that would come over and sit with her where her kids were always too busy, that sort of stuff. So, there's all those sorts of options that you can do, but it is a really good thing to do yourself, because it's quite, it's not as easy as you think, I think, to sort of think about who you might have in your circles. So we said, and really trying, be quite mindful to keep away from that family tree approach to network mapping, I think. So I guess in summary, the Help app is an evidence-based tool to integrate formal care with network-centred care and informal supports. And when we're having conversations with families and carers about prescribing this social support through the app, then they can access that support. They've got the information, as Holly has said, we've got the palliative care professional in your back pocket. And it's increasing those sorts of options for for care and different activities and increasing wellbeing. So reducing carer stress is the one that we're really keen on, making sure that we're looking after everybody that's involved in that end of life journey. So with the social prescribing, when you're having those conversations with people, and we'll send this script out as well for you, but it could be sort of, having those conversations with people, say, okay, so now we've talked about what the services that we can provide. Let's have some time together thinking about your social support. So what other elements we can add to your care plan? So there's sort of those non-medical elements. It could be 2 or 3 people, it could be 15 to help get through the time. And just sort of reiterating that importance about the well-being for the person's healthcare. So thinking outside the box about social supports and connectedness, not just close family and friends and not just next of kin. One of our colleagues sees a lady who walks past her door quite regularly, and when there was some illness in her family and she couldn't walk her dog, she was able to go out to that lady and say, oh, would you mind walking Buddy as well when you walk your dog? So there's those sorts of little incidental connections that can be just as important as those other ones. And we know you don't want to be a burden, because this is something that we find people, which is why people don't ask for help. But we know from the research that people don't see helping out as a burden, and they want to provide support but don't always know how. So that's back to that, those barriers around people asking if people need help. So we're almost done. So we have a bunch of resources. So for families and carers and friends, we have some videos. We've got a really good how-to video that's just come out that we will again send links to. There's a user guide that we highly recommend taking out to your patients / clients / carers when you talk to them about the app. It does a really good sort of how-to and the usefulness of the app. And we've got what's called a conversation starter. So on the front here, it's got the QR code for downloading the app. And then on the back of it, it's got some just some brief descriptions, and also the QR code, which takes you to that video, the how-to video I was telling you about. I think it's about 12 minutes, but it's a really good, you can stop and start it when when you're going through it, and sort of this is this and this is that, and next step, next step, next step. And then for you guys as healthcare professionals, we've got videos, we've got training that we can offer you. We've got the script, as I just said, to how to introduce the app to your clients and carers. We've got a whole bunch of other print resources that we can, again, send the links to our website. There's a checklist. And also for formal partners, we provide snapshot data reports about the numbers of networks in an area, kind of tasks that are being asked for and accepted, those sorts of things. What, how many conversations are happening? The chat function is probably being used the most wide of all the functions in there at the moment. And then we've got our website. We're on all the socials these days. We're on Facebook and LinkedIn. We have a YouTube program, a channel which has got the 2 videos that we've seen today, as well as the how-to video. And then there's obviously the downloading of the app. And every month we hold a community of practice, and we can again send out the links for signing up for those webinars. Just with people who are using the app, healthcare professionals who are prescribing it, and we're just sort of bringing together people to have those conversations around how it's going, and looking at how learning from each other as we're moving forward.
And we're going to be running some sessions for volunteers soon too, really focusing on that. Such a great resource in our communities, and yeah, absolutely. And that's it. Thank you. Thanks. We'd love to answer any questions that we can while we've still got time. Oh, we really stuck to time, Sal. That was...
I know.
Well done. Thank you, Holly and Sally. Thank you both so much. I also realised I think I forgot to introduce myself to the audience at the beginning. My name's Heath Reid. I work with Sydney North PHN, as you can see from our little logo up here. That was a really fantastic presentation. Some things I really love about the Help app is how well researched and evidence-based and ethics approved it is. but also how incredibly practical it is and how quick and useful it is for clinicians or care providers or volunteers to be able to provide that information and give that over to a network to explore. I also really like your little idea, Holly, about mapping out your own care network, like how that would work, your circle and your inner circle. And I really think that's a good model to apply to help seeking as well. Because, you know, we're all happy to offer help, but it's very difficult to accept help and even harder to ask for help. And that really got me thinking, you know, there's been times in my life where people have offered help and I've denied it. And it's only from having gone through that, I've thought, oh, maybe next time I would accept that help. But I was questioning that within myself and thinking, how would I, as a health professional, support somebody to accept help whilst being a not very good acceptor of help myself? So I think that's a really good thing to kind of process and work through to enable you to have those sorts of conversations, along with those fantastic resources that you've produced to really give us a hand. So thank you. We'll just give it a few more minutes to see if any other questions pop in. But I might just mention some of the work that we're doing in palliative care around the compassionate communities approach with Sydney North, because we have partnered with La Trobe to do some research in Northern Sydney about use of the Help app, the uptake of the Help app, who's using it and how many networks we have and how we can support those. And that's because we're a big believer in compassionate communities. We fully recognise that 90% of that care happens out in the community, and our healthcare workers do a phenomenal job, you know, but they have such a large job to do and increasingly less time to see everybody in. So we're looking at that kind of compassionate communities model of supporting the community to go out and do that at a grassroots level. But we think this is a really critical element to educate service providers as well, and also for people that won't connect with various groups to be able to have another avenue to link into that compassionate communities approach. So I think it's a really critical tool, you know, within the field to be able to utilise and share and support people out there. So congratulations on your work, and thanks so much for supplying us with the Help app.